The Application of Medical Terminology. Presentation by Jennifer Tipton. Paramedics report the patient Don Smith, date of birth July 1st, 1985, was an unrestrained driver in a motor vehicle accident about 20 minutes ago with a chief complaint pain in the lower left quadrant of his abdomen, left arm, left leg, and head. Patient denies any loss of consciousness or dizziness. Vitals were a blood pressure of 165/84, the pulse of 108, breaths of 24, the temperature of 96.8, pulse of 98%. Splints were placed on the left leg and the left arm was in a sling. The head was wrapped with gauze with signs of blood. The patient presents to the ER after a car crash with a 2-inch laceration on his forehead. He has a contusion on his left arm, left leg, and head. There is some discoloration to the left knee. The doctor will perform a physical exam to diagnose what is going on. The laceration on the patient's forehead will require stitches. The laceration will be cleaned thoroughly before it is stitched up. The contusions will require rest, ice compression, and elevation. The patient will be re-examined at a later date to rule out possible hematoma. If a hematoma should develop, then surgery may be necessary to drain it. The patient presents to the ER after a car crash. The patient's chief complaints are swelling, redness and bruising of the left arm and left leg, bone protruding out of the skin of left leg. He cannot move his arm or left leg and he is in pain. The patient reports increasing pain of the affected areas when touched. The doctor has ordered an X-ray of the left arm and left leg to see what's happened to the bone during the collision. The doctor has also ordered a CT scan and an MRI to see if there is any further damage to the nerves, muscles, and tendons. The doctor gives a diagnosis of a compound tibial fracture with several tendons that are lacerated due to the bone protruding out of the skin. He also tells Joe that he has a simple humeral fracture. The doctor has scheduled emergency surgery for an open reduction to repair the tibia. The doctor will fixate the bones with pins, plates, and rods. A cast will be used to stabilize the simple fracture of the humerus. The patient, Don Smith, presents to the ER after a car crash. The patient admits to not wearing a seatbelt and reports slamming his chest against the steering wheel. The patient reports feeling pain in the sternum area. He reports that his heart is racing. He is feeling lightheaded, having shortness of breath, weakness, nausea and vomiting, wheezing, coughing up blood, and feeling faint. The doctor is going to perform some diagnostic tests to check for a cardiac contusion. The doctor will perform tests to check the creatine kinase level to look for cardiac trauma. If the CK levels are low, it could indicate a possible cardiac contusion. The serum cardiac troponin level is extremely specific for myocardial damage. Electrocardiography, or ECG, studies have been commonly used by doctors in an attempt to predict myocardial contusion. Transthoracic echocardiography may be used to identify a cardiac contusion. Treatment for a cardiac contusion is similar to managing a myocardial infarction. The patient is usually hospitalized and placed on cardiac monitoring. Antiarrhythmic medications to treat rhythm disturbances that might have been caused by trauma to the heart are given. An IV should be placed in case of cardiac instability. The following treatments may be performed: IV catheter, pain medication for pain, blood pressure medications, arrhythmias medications, placement of a chest tube, oxygen therapy, the placement of a temporary pacemaker, drainage of bleeding areas around the heart, surgery to fix damaged blood vessels in the chest. Patient Don Smith presents to the ER after a car crash. The patient was not wearing a seatbelt and says his chest hit the steering wheel. The patient's chief complaints are difficulty breathing, chest pain, and hypoxia. The injuries he sustained can be classified as respiratory trauma injuries. The doctor will diagnose the patient's condition by providing a physical exam, taking chest x-rays, and computed tomography if a clear image is required. The doctor is trying to rule out pneumothorax, a lung contusion, or a rib fracture that has punctured a lung. The doctor finds pneumothorax and will treat it by a thoracostomy, possible mechanical ventilation, and by using pain medication. Since the patient had a car crash and is complaining of abdominal pain, vomiting, trouble breathing, and is feverish, then the doctor will run some diagnostic tests to see if there is a possible gastrointestinal perforation. Laparoscopy will be used as a diagnostic tool. The doctor will also x-ray the abdomen, do a CT scan, and certain blood tests to see if there is a possible gastrointestinal perforation. If a gastrointestinal perforation is discovered, then the patient will have emergency surgery to fix the hole in the intestine. If there is active bleeding, the bleeding spot should be clamped off and the bleeding vessels must be secured by suturing them. Patients who have significant bleeding and surgery can suffer from hypothermia, bleeding disorders, and excessive acid in the bloodstream. In such cases, damage control with abdominal packing can be done to control bleeding before a definitive repair can be undertaken. If a large part of the bowel is damaged, this part of the bowel must be removed so the healthy ends can be reconnected. The patient presents to the ER after a car crash with nausea, blood in his urine, difficulty urinating, fever, and his scrotum is bruised, swollen, and discolored. The doctor uses a urine test, physical exam, and imaging of the scrotum to diagnose the problem. The doctor is looking for testicular torsion or some kind of testicular trauma. The doctor finds testicular trauma and suggests icing the scrotum. Gives pain medication and anti-inflammatories. Surgery may be needed, and the procedure is called orchiopexy. The patient presents to the ER and reports feeling cognitively distorted, can't get over a cold, mood swings, and low energy. The patient reports that about a month ago he was in a car accident where he acquired a traumatic brain injury. Since the doctor knows that traumatic brain injuries can lead to endocrine system problems, he will do diagnostic testing to rule out any problems with hormone regulation. The doctor will perform a physical exam as well as blood tests to check for hormone levels. The doctor finds the patient has hypothyroidism and suggests hormone replacement therapy to treat the condition. The patient was in a car accident and presents to the ER with partial paralysis to one of his legs. He is reporting myasthenia, pain in his lower back, dystonia, having prickling sensation, numbness of the skin when touched, and increased sensitivity to hot and cold sensations on the skin. The doctor will use an MRI and a CT scan to diagnose the problem. The doctor is trying to rule out radiculopathy or neuropathy. The doctor orders an electromyogram to further his diagnostic impression. The doctor gives a diagnosis of car accident radiculopathy. Surgery will be needed to be performed to take the pressure off the affected nerve root.